Hey everybody, welcome back. This is Dr. Stokes for Bread and Butter Primary Care. Continuing on another video going in a little bit more into hypertension or blood pressure. And my ideas for these videos is to make them short, concise, so that it's just a little bit of information to take in every time. I think a lot of videos that are available as far as medical information are 30-40 minutes. They go into all the details of, say, take hypertension, and then they do how to diagnose it and how to treat it and how to prevent it and everything in one video. And it's kind of a lot to take in. And so I have a video about what blood pressure is and why it matters. This is going to be a video about accurate measurement of blood pressure and how it's currently defined under the newest guidelines. There's going to be other videos about how to treat it, what medicines to use, lifestyle things that can help. Another video about hypertensive urgencies and emergencies, those times when the blood pressure needs to be addressed more immediately. So each one's just going to be a little bit, so we'll get right into today's information, which is accurate measurement of blood pressure and then how it's currently defined. So like I said in the last video, blood pressure is something we check on everybody every time. And unfortunately, the way we check blood pressure, especially in like a busy primary care office, isn't very accurate a lot of the times. And that's part of the reason for the phenomenon of the white coat hypertension or the white coat blood pressure, where people come to the office, high blood pressure, but they say, I check at home or whatever, and it might be lower. And it does lead to some confusion as far as, what do I do? The person's here, let's say they have a blood pressure, it's coming in 145 over 90, and previous blood pressures have been normal, and what's going on. And so few things for accurate blood pressure measurement. It's difficult to do, especially in a busy practice where you're seeing over 20 people sometimes a day, and each person only has 15 minutes, and there's so much information that has to be gathered. And so what oftentimes happens, well, let's start here. The best way to check blood pressure is when someone's relaxed, seated, with their feet on the floor, supported, back supported, and they've been in that position for 5 minutes. Then you check the blood pressure. That doesn't happen at the office. They're stressed out because they're coming to the doctor. They just walked in. They're being asked 100 questions. They sit up on the table. Their feet aren't on the floor. They don't have back support. And then they have their blood pressure taken. Having them sit for 5 minutes before taking it sometimes in the real world might not be realistic. So what do we do? So ideally, that's the way to measure blood pressure. Oftentimes what I do in my practice is the MA brings them back. They get the blood pressure. If it's high, they finish the intake, getting some of the history and all that kind of stuff. They check it again before they leave. So at least to give some time. If I go in and it's been high, oftentimes at the end of the visit, after I've been sitting there and we've just been chatting, I'll check it and see if you can maintain that. There's actually, the gold standard actually for diagnosis of high blood pressure, hypertension, is at-home ambulatory average blood pressure. And that would be where you actually put a catheter in someone or some sort of measurement device, and you just get their blood pressure and you average it over 24 hours when they're just going about their daily life. That's not obviously realistic to have patients do that. So I do oftentimes have people check at home if I feel like they can be compliant with that and that they can handle that. I'll have them say, hey, once a day when you've been seated for 5 minutes, relaxed, check your blood pressure, write it down. After a month of that, come in, let's look at the numbers. We can then decide if something needs to be done. Oftentimes home relaxed measurements are more accurate, but the drawback of that is whether or not the patient's actually going to do that. Will they come back in a month with their numbers? Like I said, I've worked a lot with Medicaid and Medicare uninsured patients. They have a lot of barriers to care, and so sometimes it's very hard to have that frequent follow-up. And so decisions you have to make kind of patient by patient as far as what you're going to do there. But anyway, that's a little tidbit on accurate blood pressure measurement. As much as possible, make sure their feet are on the floor, their back is supported, they've been sitting for a few minutes, then check the blood pressure. As far as numbers, all right, now I graduated medical school in 2013, and so it's only been about 7 years, including residency, that I've been doing this, and I've seen these standards and goals for blood pressure management change in my time already. And so it's sometimes a bit of a moving target. But currently, there's kind of 4 categories to remember. as far as blood pressure. And I like to put things, when I teach my medical students, I like to put things into groups where you can remember that. And so if you remember, there's 4 categories when you're thinking about blood pressure. So normal, elevated, stage 1, stage 2. Okay? Normal, 120 over 80 or less. So if it's that, you don't have to do anything. Normal blood pressure. Elevated, between 120 and 130 on top, 80 and 90 on the bottom. So those people are elevated. They're not to stage 1 or stage 2. And in those individuals, we usually would recommend just lifestyle changes, daily exercise, low salt diet, no other interventions. Stage 3, or I'm sorry, the third group, stage 1, is between 130 and 140 and 80 to 90 on the bottom. Stage 1 is where there's patient shared decision making. So shared decision making is a term we use for when there's not really a set rule per se as to what you should do. It depends on what you think, on what the patient thinks, and a conversation you have together. So when you have people in stage 1, so let's say they're 135 or 85, stage 1 hypertension, you've checked it at home, you've got several measurements, because technically you need at least 2 measurements on separate occasions to diagnose hypertension. That's a conversation to have. What are their other risk factors for heart disease and for other things? If they have other problems, if they've got some kidney disease or maybe they have some diabetes, you're probably going to tend to go to pharmaceuticals or drug therapy a little bit sooner. If they're otherwise completely healthy, it's probably reasonable to monitor and do some lifestyle changes. Stage 2 hypertension is 140 over 90 and above. So if they're above 140, they're above that 90 mark, now they're stage 2, and it's time to talk about pharmaceutical drug therapy in addition to all of the lifestyle changes. Now, there's going to be another video where we'll talk more about what those lifestyle changes are, what those drugs are, and all that kind of stuff. But today I just wanted to cover those 2 real simple things: how to measure blood pressure to make sure it's good and accurate, seated, feet on the floor, back supported, 5 minutes, then check whenever possible. I understand it's kind of hard sometimes. And then the groupings, especially for medical students, as you're going in and going to report to your preceptor, you know, you get some extra points if you say, well, this person is elevated, this person's in stage 1, therefore I want to just do lifestyle. This person's in stage 2, I think we should talk about drug therapy. So there's those 4 groups: normal, less than 120 over 80, elevated, between 120 and 130, 80 to 90, stage 1, 130 to 140, and then stage 2 above that 140-90 mark. So a little bit for blood pressure, how to stage it out, how to measure it. I hope you guys have a great day. Stay tuned for more information as far as how to treat blood pressure and what to do when it becomes too high to just do home therapy.